Happy Monday morning. Today, a brief discussion about differences in osteotomy between the basal implantology and the conventional implantology. Usually, in conventional implantology, the method will be different steps. That is a sequential drilling. We do sequential drilling. So that is first is with the pilot drill or the marking drill, then followed by 2 drill, then 2.3 2.8 3.2 4 In that way, we go till up to 4.5 drill. So the type of drill here we used in conventional implants will be both the twisted drill also we use and also the tapering drills also we use. So usually I use for this conventional technique osteom kit I have. So osteom surgical kit I use. Osteom surgical kit is the best one. It has got stoppers. Stoppers means if the length of the drill what you are supposed to drill is up to 18 or 20 till that end there will be stopper. You cannot drill beyond that. So in that way you will not go beyond whatever the length you want to drill. So it will minimize any defect which is going to happen. That is, if you are going to drill more, you cannot drill if there is a stopper. So it will stop wherever it is desired. So different kinds of drills we use in conventional technique. Then we place the implant of desired dimension and length with the handpiece. So that is aerotor handpiece, that is implant handpiece we use. So implant handpiece will be for the lower, it will be of contra-angle handpiece of 20:1 gear ratio, and the upper it will be of 1:1 gear ratio straight handpiece. So the speed is I use woodpecker handpiece. The speed I keep is usually between 1800 to 2000 rpm. So if the cancellous bone is a very fragile kind of, I'll keep 1600 1400 also, and the torque I keep is usually between 35 to 50 depending upon the type of bone. So the different steps are there in conventional technique. We have to follow the sequential drilling, whereas in the basal implantology usually we follow single drill technique or otherwise a two drill technique. Single drill technique is first is analyzing the OPG and CVCT, the length of implant to be placed, for example in the maxillary nasal floor. So we will gauge the length of the implant. Suppose we plan is 21 or 23 first we go with the pilot drill. So depending upon the type of bone, you will get to know while doing the osteotomy. You will place after the pilot drill only, you will place the implant of desired length of maybe 4.5 by 20 or 5.5 by 23, all those things. That you should decide which length you want to place to perforate the nasal floor. So that is the single drill technique, whereas in the two drill technique, after the pilot drill you are going to use a 2.1 drill or 2.3 drill of twist drill. Suppose if you are going to place the BCS implant, usually we play a twist drill will be used. If you are going to place the rough surface, conical drill will be used, okay, in basal implantology. So in that way we use only limited steps in basal implantology, that is one drill technique or two drill technique. Then we go with the placement of the implant. Here the placement of implant will be with the driver. So your driver should be compatible with your hand, so it should have firm grip so that you can apply pressure while placing the implant. You have to engage in the proper D2 bone so that the implant will be stable and it will give good stability and anchorage. So this is the difference between the osteotomy. So that is the technique of osteotomy we do, the comparison between the conventional implant and the basal implantology. So while if you want to remove the implant for any reasons, here in the conventional implantology we use the low speed implant handpiece only, but whereas in the basal implantology we use the driver only to retrieve the implant if anything, if it's need to be needed. So once after the placement of the implant in conventional implantology, this is we have to wait for 3 to 4 months for osteo integration to happen. Then only we go with the prosthetic rod. Till then we can give the temporary crown. So usually the conventional implantology will be with the screw retain type of crowns we give, whereas in the basal implantology this method is after going to engage the implant in the D2 bone. So it is a osteo fixation. This method is osteo fixation or osteo modulation with the bone, we call it as. So since it's going to fix osteo fixation method, so we can immediately load the implant in the basal implantology. So if the torque and stability is very good and primary stability is awesome, you can give the permanent loading only in the starting itself. So if the torque is not that good and the stability is up to the mark, you can give the temporary crown for a few months, then you can go for the permanent processes. So that is the difference between that is in conventional implantology, it is through the osteo integration, whereas in the basal implantology, the method is through osteo modulation or osteo fixation. Thank you.